Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, recovered from COVID infection and now 40 years old since we spoke to everybody last. So
you look good, Brian.
Thanks.
You look good. We feel good. We're very blessed to be healthy, back in the office, back working in the ER. Our office here at Health and Healing is open. We've completed our mandatory isolation period for myself and quarantine for my nurse, Anna Maria. Spoke to the health department about sort of all the guidelines that we were compliant with and consistent with, and that was always good learning information for us to make sure that we're doing all the right things, taking all the right steps to keep our patients safe.
So all systems go.
All systems go. We need to be back because we're going in the wrong direction, Dr. Brian. Our cases are, at an average of 200 cases per 100 or 20 cases per 100,000. Right now, we need to be at 7 cases per 100,000 to go down into tier 2. We're just nowhere near that. We were doing really well until about the week before Halloween. We started going in the wrong direction. There's a lot of reasons for that. A lot of people that are in the house more as the weather cools down a little bit. There's more gatherings, and really the household transmission is kind of where it happens. So,
sure.
So we have to be really diligent, especially through the holidays this year, about not only social distancing and hand washing, mask wearing, but testing. I mean, we are very fortunate here in LA County to have the availability of tests that we do have. Mm-hmm. So testing before you go into a gathering and testing after you're coming out of a gathering, and quarantine if appropriate. You're going to be around people who are certainly higher risk. But what I wanted to talk about today was a positive note on the COVID-19 front.
What's that?
The vaccine update. And Pfizer's announcement that their mRNA vaccine showed a 90% efficacy. And that's what we've been waiting on, that data from all these these phase 3 trials.
And that was a pretty big study that they did, right? It was like 40-some thousand patients?
Yeah, over 40,000 patients. They had about 62 cases of confirmed COVID-19 that they studied. And they looked at the patients that they injected the vaccine into versus the placebo group, and they showed about a 90% efficacy, which is huge.
Yeah, that's great.
When you think about our flu vaccine every year, our seasonal flu shot maybe gets to about 70-ish%.
Yeah, so this is much better.
On a well-matched year, as you know, with flu shots, they're different every year. So if it's a poorly matched year, you're more like in the 30-40% range.
How was this vaccine given, though? Is it a one-time dose? Is it multiple doses?
This particular one is 2 doses, about a week apart. Looks like the efficacy was was achieved at around 28-day mark of after completion of the series. So around that time is when you were kind of mounted your antibody response and you were considered protected. Similar, flu takes about 14 days, they say, that flu shot. But this is a very interesting vaccine. This is something that is not a new technology per se, but it's new to kind of us talking about the way we do vaccines. Do you remember your molecular and cell biology, Dr. Brian?
Nope.
No? Do you remember what RNA and messenger RNA does?
Yeah, I remember that stuff, but I like big stuff. Like
anatomy.
Like come in with your arm cut off. I got that because it's big. It's easy diagnosis.
Yeah,
I'll help you out there. But like all this molecular and cell biology, immunology was always really tough for me. So you were the expert in that. You majored in that in college too.
That was my jam. I loved MCBM at Berkeley. That was my major. Yeah. But the way this vaccine works, and again, this technology is not new. It's been around for several years, and is basically the RNA. They develop the RNA in the lab, and the way they develop the RNA compared to the way they typically develop vaccines, the technology is a lot faster and more responsive to things like a pandemic where you have a rapidly changing virus or that's mutating. They can make changes to the RNA more quickly and be more responsive in a crisis like this, in a pandemic. And their typical development of a vaccine is like, making RNA in a lab is about 2 months, where your typical culturing of a vaccine in in an egg, which is what we typically do, it takes for flu 5 to 6 months to develop those vaccines. So that's why it's been so fast. Right. So developing this RNA in the lab, And what the RNA does, they inject that RNA into your body, and it gets fed into your immune cells, and your immune cells then take that RNA and decode it and make the antigen, make proteins. RNA is in charge of making proteins. That's what it does. Makes the antigens that it's been encoded to make, and expresses those antigens on the surface of the cell. Okay, remember?
That's
and then your body makes antibodies to those expressed antigens. And so
science.
So amazing science. It does all of this without disrupting your own body's natural DNA or anything like that. It's sort of working in parallel in your immune system, and has a typical, a more robust. You can really, you can plug some little nucleotides in that RNA molecule to really overly express the amount of antigen you make too, versus you get like the regular flu shot, and then the high dose flu shot is just a more concentrated amount of antigen, and that hasn't really been shown to be as great clinically in terms of making more antibodies. It is indicated in over 65, but clinically, does that bore out to a better immune response? Not really, but this does. This is a more scientific, precise way of doing that. So you can code that mRNA to make more antigen, and then subsequent have a larger antibody response.
You getting that, everybody out there?
So it's so awesome. 90% effective.
All right. You love it, obviously.
It's awesome.
I'm excited about that. 2 questions. 1, is it safe?
It's very safe. They reported no significant safety issues when they study safety. It's usually during phase 2, phase 1. But yes, they had, and then in phase 3, they also still look at safety, and they reported no safety issues with this vaccine.
Okay. And 2, when's it coming out?
They look like they're going to have about 50 million doses by 2021, and maybe 1.2 billion.
You think we'll get a Christmas present with a new vaccine, or no?
So it will be a difficult distribution logistical problem. This particular vaccine has to be kept at very, very cold temperatures.
Cold. Like negative. Like 90, right?
Yeah, very, very, very cold. So an office space like mine is not really set up for that. I don't have the capability to store that. So this will probably be distributed nationally, statewide at stations, and distributed in a safe manner that way. They've been making this vaccine while they've been proving efficacy during their phase 3 trials. These companies have taken what they call at risk. We've talked about that before. Huge financial risk by massively making the vaccine while they're trying to prove efficacy. So it's not a matter of do they have it? They have it. It's a matter of distribution and how do we get it out to the masses. And
the fact that you have to give 2 doses to every person instead of just 1.
Yeah. I mean, that's a little bit of a logistical issue too, but hopefully we'll do it to people, frontline workers, and then people who are higher risk, so we can get some way of really streamlining that distribution. All right. So
let's wrap this
really
puppy up.
exciting news. It's just mind-blowing how incredible science works and how responsive we've been able to. I mean, when you think about it, we've been doing this for 9 months, but it's only been 9 months, and we already have a potentially very effective vaccine. We've learned a lot along the way, too. There's a lot of lessons that we've learned through this pandemic about what's really important, and how to acknowledge and practice gratitude along the way.
That's a nice way to end it, Dr. Ostick.
Happy Friday the 13th.
Ooh, I didn't think about that.
It's been exactly 8 months. We've been doing this because we went March 13th. We went home from, they sent the kids home from school, and that was it. Done. Shut down. Now.
Crazy.
Well, so call us if you need us. We're here for you. healthandhealingdpc.com, 818-600-2426. Thanks.
I'm back in the ER if you have any emergencies. I'll see you there. Hopefully not.
Bye.